Hi, so we made our presentation on Streptococcus pyogenes, and this presentation was done by Emily Hobbs, Hope Jordan, Morgan McGarry, Ariana Quimby, and Callie Ross. So this structure for Streptococcus pyogenes, it is a gram-positive microbe, and this indicates that its cell wall has a thick layer of peptidoglycan and a plasma membrane, but it does not have an outer membrane. An individual microbe would be around 0.5 to 1 micrometer, but they're typically arranged in chains as seen in the picture, and this causes them to be longer. They are cocci, non-modal, and do not form endospores, and since they are non-modal, they are not capable of movement, so they don't have any of the features that they would need, like flagella, to move. S.pyogenes is a facultative anaerobe, which means they use oxygen to create energy when it is present, but they do not need oxygen to survive. They also contain a fibronectin protein, which allows it to adhere to epithelial respiratory cells, and this causes many infections in that area of the body. It contains an M protein, which allows the bacteria to resist phagocytosis. Phagocytosis is a kind of endocytosis where the cell membrane engulfs infected cells and ultimately destroys them. And by resisting phagocytosis, cells that are infected with S. pyogenes can live longer inside the host, and they cannot be as easily destroyed without phagocytosis. They contain an outer hyaluronic acid capsule, and S. pyogenes is a fastidious bacteria, and it requires complex media with specific nutrients in the culture medium to grow and thrive.
Hi, my name is Morgan, and I'll be presenting on pathogenesis and virulence factors of Streptococcus pyogenes. So, the pathogenesis of Streptococcus pyogenes infections begin by the bacterial organisms binding to the epithelial cells located in the skin, nasal cavity, and oral cavity. Fimbriae-like structures anchor various molecules of S. pyogenes into the cell wall, and then they must begin to bypass the immune system. And it does this by evading phagocytosis and confusing the immune system. It must then survive and replicate in the blood, and then it will spread to other organisms via the bloodstream. This picture is kind of demonstrating how S. pyogenes goes through the steps of pathogenesis. It begins by adhering to the human epithelial cells. Then it explains how it goes. It evades the immune system, survives in the blood, and spreads to various organs via the bloodstream. Streptococcus pyogenes can produce many virulence factors that cause severe invasive infections. These virulence factors include bacteriocins, hemolysin O, streptokinase, NADH enzyme, and hyaluronidase and N protein. Some of the roles that the virulence factors play include M protein and lipoteichoic acid act in attachment to cells. Hyaluronic acid capsules inhibit phagocytosis. Extracellular products like pyrogenic toxin cause scarlet fever, and FN protein act in adhesion and invasion of the epithelial cells.
So my name is Hope, and in this slide I'm going to be talking about the disease and development of streptococcal infections. So some of the signs and symptoms of an infection is sore throat, a fever, and it's considered medically significant if it's 100.4 degrees Fahrenheit or over. An individual can also develop rheumatic fever, which is an autoimmune disorder that develops from strep throat. An individual can also have kidney damage. They can also have wound and skin infections. In specific, they can develop impetigo, which is a skin infection that causes red sores on the face. An individual can also have necrotizing fasciitis, which is a flesh-eating disease characterized by fever, severe pain and swelling, redness at the wound site, and later you can have fluid discharge from the infected tissue, skin loss, and low blood pressure. An individual can also have shock, which is characterized by low blood pressure, a rapid, shallow breathing, cold and clammy skin, a rapid but weak pulse, dizziness, fainting, and overall general weakness. And in the photo here on the right, you can see the normal human mouth compared with the abnormal human mouth, in which there's whitish spots like on your tonsils, and your throat is red, and the tonsils swell as compared to the normal tonsil. And then in this slide, this is the disease that a streptococcal pyogenes infection causes, which is known as streptococcal pharyngitis or strep throat. And some characteristics of this disease, it is the infection of the oropharynx. The bacteria known as S.pyogenes replicates in the throat and tonsils, which causes an individual to have painful swallowing, red or swollen tonsils, swollen and tender lymph nodes, and a fever. And in these photos, you can see the tonsils are very enlarged, and in the one on the left, they do have the whitish spots on the tonsils. And in both photos, they have the red throat, which is primarily causing the sore throat.
So my name's Ariana. I had the spread of disease part. Essentially, if people have poor hygiene, that's going to cause like the spread of Streptococcus pyogenes by fomite, which is like objects that you would think would harbor the most bacteria, like door handles, just anything that you're touching regularly. Direct contact as well, you know, touching other people with dirty hands is going to cause a spread of it. They're airborne droplets, so coughing, sneezing, and sharing food or drinks is going to increase that spread as well. Humans are a reservoir of this disease. They can survive up to 7 days intracellularly in the respiratory cells, as stated in the structure part. They grow best in antibiotic supplemented medium. So patients who are diagnosed with tonsillitis, just basically if they've had it numerous times, it's because the cells are able to adhere to the host cells really well and live inside of the epithelial cells, which is my next part of this. They reside in macrophage and epithelial cells to best take advantage of the host and continue spreading or causing remittent symptoms of this disease.
All right, so my name is Emily, and I have the prevention and treatment of this disease. Streptococcus pyogenes bacteria live and thrive in the nose and throat. So this kind of goes to show like how easily they can be spread by like the simplest cough or sneeze, which would expel droplets onto yourself or a surface or even someone else. So it's important that you prevent it in the correct ways. If you don't have the disease, you can prevent it by proper hand washing, not touching your eyes, mouth, or nose, and not sharing drinks or food with other people. So for proper hand washing, that could mean that like if you were to touch a surface that had droplets of the disease on it, that could keep you from then moving the bacteria into your portals of entry or like mucous membranes, which would allow it to get into your body, and then that's how you would get sick. And the last one seems kind of self-explanatory, but sometimes people don't know that they have the disease, or maybe they don't show symptoms yet. So sharing drinks or food would allow those bacteria to move between people and then get more people sick. And also, if you are sick, you can prevent other people from getting sick by making sure that you cover your cough or wash your hands a lot so you're not spreading any germs between yourself and surfaces, which would help other people from getting sick. When you go to the doctors, there's 2 different ways that they can diagnose you. Typically, by just looking at your throat, it's pretty like self-explanatory that you would have the disease, because there's so like your throat would be so swollen. So doctors will typically do a rapid strep test first, which takes about 15 minutes, and they can do it in the doctor's office. As you can see in the picture, they just swab the tonsils of the patient. And this test will test for the Streptococcus pyogenes antigens, and that's how they can find it so easily. But this test is typically more like, we'll give a false negative more often. So if that comes back negative, but your symptoms still show that you likely have strep throat, the doctor can order a throat culture, which is done using the same technique of swabbing the tonsils. However, this test tests for Streptococcus pyogenes, the actual bacteria of the disease. And so this one usually takes a little bit longer and will take between 24 and 48 hours. But this one is more accurate at telling whether or not you have strep throat. For antibiotics, this is typically used to treat the disease. And these will decrease the amount of time that you're sick for, help get rid of symptoms, and also help to keep bacteria from spreading to others when you're sick. And the most common ones that are used are penicillin and amoxicillin, but there are some other options that can be recommended if the patient has an allergy to penicillin, but that's not the most common we use ones. And then we have our works cited here.